Hi everyone, welcome back. Today we are going to start the part 8 of our clinical case scenario series. So let's begin our today's lecture. Here you can see the scenario number 36 on your screens. A 38-year-old patient has a diagnosis of grave disease. So which of the physiological response to exercise you can expect for the patient in relation to their diagnosis? Option A, elevated heart rate. Option B, increased respiratory rate. Option C, decreased heart rate. And the option D, elevated oxygen saturation. And the correct answer is option A, elevated heart rate. Let's see the explanation. The grave disease is an immune system disorder that results in the overproduction of the thyroid hormone, which we named as hypothyroidism. The patient with the grave disease often have an overactive thyroid. So the hypothyroidism can further lead to elevated heart rate. Let's jump to another scenario. A 39-year-old male patient comes to you with a complaint of pain from the gallstone, often referred to which area of the body? Option A, chest area. Option B, left shoulder and scapular area. Option C, right shoulder and scapular area. And the option D, right lumbar and posterior thigh. And the correct answer is option C, right shoulder and scapular area. And here we have the explanation. As we know, the distribution of the organ in the body often referred the pain to other area of the body. So the gallbladder pain often referred to the right shoulder and the scapular area. Let's move to another scenario. When determining the therapeutic exercise for the patient in the phase 1 management of the lymphedema, so which of the following is most appropriate? Option A, the passive range and the bed exercises only. Option B, jogging. Option C, seated activities only. Option D, light exercises such as walking and the light resistance training. And the correct answer is option D, light exercises such as walking and the light resistance training. And here we have the explanation. As we all know, the exercise is really beneficial for the patient undergoing the lymphedema treatment. So the light exercises is recommended, but the high intensity activities should be avoided. Let's jump to another scenario. You are performing seated exercise with a patient in acute care that has complete spinal cord injury at the level of T5. While performing the exercise, he reports a sudden onset of pounding headache and his face is flushed. He begins sweating profusely and is nauseated. So you suspect autonomic dysreflexia. So what is the best next step is to option A, have the patient rest for 2 minutes and then resume the exercise if the symptoms dissipate. Option B, call for the emergency code. Option C, transfer the patient back to bed and have him rest for 5 minutes. If the symptoms do not improve, call the nurse. Option D, check the catheter bag and the tube for kink, blockages or fullness. And the correct answer is option D, check the catheter bag and tube for kinks, blockages and fullness. Here we have the explanation. As we know, in the case of autonomic dysreflexia that can be caused by the backup of the urinary flow due to disruption of catheter, blockages and full bag. The therapist should immediately rectify any visible catheter disruption and then call for the nurse. Let's see the last scenario of today's lecture. In a patient with poorly managed diabetes, which of the following is a precaution that should be taken in the plane of care? Option A, using the position during the balance activity as the diabetes can have decreased proprioception due to neuropathy. Option B, checking the blood glucose level before and after the treatment to ensure the normal level for the safe exercise. Option C, monitoring the blood pressure as diabetics are often hypotensive. And the option D, using heat before the exercise to promote the blood flow. And the correct answer is option A, using position during the balance activities as diabetics can have decreased proprioception due to neuropathy. And here we have the explanation. In the case of poorly managed diabetes, that can cause damage to the peripheral nervous system that beginning distally. So the people with the chronic unmanaged diabetes can experience balance issues due to decreased proprioception as a result of this damage. So that's all for today. We are going to discuss our next scenarios in our upcoming lectures. Thanks for watching.